Welcome to the Expert Edge. This is the show where we bring on experts in their fields of health and wellness practice, and we hear their stories and learn what they see working in the field of diabetes reversal and prevention. And I am happy to introduce today's guest, Dr. Meg Saunders. Welcome.
Thank you, Lucia. It's good to be here.
Dr. Magon Saunders is a registered and licensed dietitian, but she has extensive experience in public health, nutrition, forgiveness, and health equity. She serves as the founder and executive director of Forgive for Health Ministries in Stone Mountain, Georgia. That's where she focuses on the intersection of forgiveness and health, particularly among minority populations. She has contributed significantly to diabetes prevention and management and health systems improvement. Dr. Saunders is an author and recipient of the Hubert Humphrey Award for Service to America. She has over 30 years of experience in public health, having worked in leadership roles in the United States, in the Cayman Islands, and Jamaica. Her academic credentials include a doctorate in health science with a concentration in global health, a master's degree in allied health with a focus on nutrition education, and a bachelor's degree in community nutrition. So tell us a little bit about how you got started with your interest in food and health.
Well, if you go back to food and health, we are talking about 1977. I grew up in a restaurant in Jamaica, and one of my tasks was to become one of the first members in my family to finish college. And my task was to go to college to learn, this was in quotes, how to run the business appropriately. So I set off in 1977 to go to university to learn how to manage this business. So my interest started in food and nutrition. So I have a degree in institutional management and catering. Still love to cook. That's something, it's my blood. I mean, I was almost born in a kitchen. And so that's sort of where food and nutrition started. And I went into college and immediately wanted to switch to dietetics. I was told, however, that I would not make a good dietitian. And so I was not allowed to go into that track. So I stayed on the catering track and then went out to work and immediately got sort of a baptism by fire in the dietetic department, and the rest is history. And so that's taken me all over the world, including working in Jamaica, the Cayman Islands, all in the US, and all over. And so that's my first sort of foray into this area.
That's so interesting. I love hearing people's stories. But then you kind of did a little bit of an angle shift as you moved into forgiveness and its connection to health. What took you down that road?
What took me down that road, Lucia, was a doctoral degree. So in 2006, I was a part of a US contingent of diabetes educators that went to Cape Town, South Africa for the World Diabetes Congress. And as a part of that travel, we had the opportunity to petition the UN to add diabetes as the first non-communicable disease to have this charter around the world, to have a World Diabetes Day. I'm sure you remember that every November 14th. We were signatories to that in South Africa. And so as a part of that, coming out of South Africa and sort of watching the years go by, I thought when I came to my doctoral studies as a person working then in the Division of Diabetes Translation at CDC, that I would focus on diabetes. Now, fast forward to college and leaving, my first, couple of months of being, my first job really was a community health worker. And I started working in dengue, telling people how to get rid of water. And then they asked about to volunteer for diabetes. And my love for diabetes started way in the hills of Jamaica. But back to South Africa, I felt like it would have been really great for me in 2013, since 2006 is when they started, 2013, to look at what's happened around the world, given this United Nations push. And so I thought that I laid out a study framework. I sort of did some research thinking I could go back to some of these countries. Now, if you've never been to a World Diabetes Conference, you have the opportunity to meet 194, maybe 200 or more countries of the world. So I thought it would be a good way to sort of connect with some of those people I have met in sort of Cape Town, research what's going on, how they have celebrated the month, the year, how they have sort of expanded education, and how they've made changes for diabetes. So that's where my brain was. But unfortunately, God had a different plan, or fortunately for me, I think, because in this time, I had a way of separating, like most of us, my personal life from my work. And so I
Yeah.
had at this time been invested in singles ministry, running a divorce care ministry in our church, working with single moms and their kids and single dads. But all of that was separated from my work in public health. And so I was headed out my door one Wednesday evening, running to the church for a class, my divorce care class, and my phone was ringing. Now I had a baby and some other kids, 6 kids in the house. And I was packing them in the car, and the phone just kept ringing. And I'm like, go away, because I'm rushing, I'm late, and this phone is ringing. The person seemed to be persistent. So I put my baby, who is now 26 and a molecular biologist, in the back of the
Oh.
car in her seat, and came back because it just kept ringing. And I answered the phone, and it was basically a divine intervention.
Hmm.
Somebody was calling me from Florida. And she was just ready to chit chat. She was in my class. I was working on my doctoral studies then. And she said, what's going on? And I'm like, hurry up. I had to go. But she started to, and I said, what are you doing? I'm headed through the door to go to divorce care. And long story short, she proceeded to talk with me and said, what was it that was a topic for tonight? And I said, forgiveness. He said, no way. I said, yes. She said, well, I'm talking to you from a copier in our office in Florida. And I'm looking down on the article that says forgiveness is linked to back pain. I said, no
Hmm.
way. And so God used that connection to bring me to my first article on forgiveness. Now, I had been noticing and looking and hearing anecdotally that people who were unforgiven were very sick. And I saw that in
Hmm.
the population I was serving. But here was the first substantive article that I had seen, peer review literature. It's actually a randomized controlled trial. And so
Hmm.
I took it to church that day. And let me tell you, there was bawling. People were crying because, and I
Hmm.
still remember that woman who had been married 3 times. And her
Hmm.
story was, oh my God, now I know I never stop having back pain. I have not forgiven my last 3 husbands. This was a true
Hmm.
story.
Wow.
And so, I saw this study and I just kept digging. I'm a data hog. I love to read ferociously. And so, long story short, I still remember the Friday after much praying and not sleeping and sort of tussling with God about what to do, when I felt clearly directed to work on forgiveness in my doctoral study. So I had to go back to do
Hmm.
all of what I had already done in the research and all the laying out of the hypothesis. And I
Right.
remember the Friday morning sending that message out to my mentors at the CDC. And I had barely hit send when somebody was knocking on my door, and he said, no way, you're not going to be studying diabetes for your doctoral degree. We need more Black African American researchers in this area. And I'm
Yeah.
like, it came out of my mouth, Lucia. And I know I said, God is going to use this to connect my secular life to my work in
Hmm.
ministry. And
Hmm.
that's been it. I know it's
That
a long
is an
story,
amazing
but it
story.
was
But
a
that's an amazing story.
fascinating way that he pulled me into this. And as I read the research and saw especially the impact of unforgiveness on a
Hmm.
population, especially African Americans and other minorities who are already stressed and weathered, I
Hmm.
could not go back. And
Hmm.
so I lived through the study, I lived through the research, I lived through the publication of the article, which interestingly happened on my birthday in 2013.
Hmm.
But and I thought, God, my hair is back on. I'm gonna let this go, but I could not. And so one by one, bit by bit, like God works, he drops these breadcrumbs and he takes me on this path. And now we have a full-blown ministry, and that's all
Hmm.
I want to do. So
Wow. That
that's the
is amazing.
backstory. That's the
Yeah, that's a
backstory.
great backstory. But let's jump into some of the science because you've been really looking at the research and the connection between forgiveness and health and specifically diabetes. So I'd love for you to share your slides and just walk us through this.
All right, let me jump into a few slides for you. Let me know when you can see what I have in front of you.
All right, it looks like we're starting to see a share, but I don't see the slide quite yet. So just give it a minute. Okay, I can see it. Go for it.
All right, you've already introduced me, so I'm not going to waste
Yeah.
time on that. Let's just quickly run through these. I'd like to start really this discussion by talking about something called flourishing. You might say, well, this is not forgiveness. And you're a nurse, so you know about flourishing. Really, it's a
Mm-hmm.
state of really living a deeply fulfilling, meaningful, and well rounded life that everybody deserves. I think it's a human right. This is where somebody thrives across multiple dimensions, both emotional, physical, social, and moral. And it's a life of purpose and self realization. It includes those things that are bolded here, Lucia: positive
Mm-hmm.
emotions and life satisfaction, strong relationships and social connections. And you'll hear some threads today: physical and mental health, a sense of purpose and meaning, or meaning and purpose, character and virtue, and financial and material stability. But none of this, I will say, and I'll bet my bottom dollar on it, is possible without forgiveness, which really acts as this powerful catalyst for
Mm-hmm.
emotional healing. And it also, of course, embraces this broader dimension of human flourishing. So I wanted to start there because many people cannot understand the connection with all of this. And so, but you might say, what is forgiveness? And so we have chosen a very old definition in the ministry. It's the act of deliberately giving up resentment. So you're giving something up to foster this undeserved quality of beneficence or goodwill and compassion towards an offender. This is the definition we use. It's a 1996 definition, but it still stands and it actually captures or speaks to different types of forgiveness. And I'm going to share that with you briefly. There are different types of forgiveness, right? There's the ones we want to focus on today is decisional forgiveness. If you go back to the definition, you're deciding to do something, right? So decided is
Mm-hmm.
this issue of what is controlling your behavioral intentions. So if you go back to the definition, you'll find that there are two types of forgiveness listed there. Then there's the emotional piece, right? Which is really where the difficulty is. I'm angry. I am upset. I am depressed. All of these things, and somebody's hurt us. So it's really a replacement of the negative, unforgiving emotions with positive, other oriented emotions. So you're thinking about somebody else over yourself. This, Lucia, takes a lot of time and it's hard work, but it is possible. You're looking at a trophy of forgiveness. I don't have time to tell you my story, but I believe without a shadow of a doubt, I am alive today because I chose to forgive.
And I'm going to have to bring you back to tell us that story.
I am speaking to a nurse. And so I wanted to say that forgiveness is just not something Megan's taught about, but it's in the nursing classification intervention. It's NIC 5280. And it's this intervention that focuses on helping people release the resentment, remember my definition, and the negative feelings towards somebody, and then offering this therapeutic technique such as guided reflection, counseling,
Mm-hmm.
or bibliotherapy. If you pair that with stuff like related interventions such as coping enhancement and emotional support, you have a more holistic, whole person approach to health and wellness. That's what we do at the ministry. Many people will pay anybody to help them increase their wealth, to help them to increase their health outcomes, and to help them improve their relationships. We can't promise wealth, but we do all the other two. We help people to improve their relationships. We help them to have better health outcomes through our work. And given the fact that they live long enough, they might actually improve their wealth. So I wanted to drop that in, unashamed about that. So I just mentioned earlier today that we had a published study out of Harvard today, and I wanted to start by just quickly running through this, right? So we talked about flourishing, so I'm coming back to it. This was published today actually from Harvard. It's a global human flourishing project with over 200,000 participants in 22 diverse countries across 6 continents. And this is
Wow.
national representative sample. It's going to run for 5 years. And we just got the first wave study of the first wave today. Here's what we found in the first wave. Youths are struggling, not only in America, but across the world. They have less purpose, and they have lower mental issues with their mental health. We also found, interestingly, in the study, that middle income countries outperform wealthier ones when it comes to forgiveness. And they score higher in meaning and social connectedness than, wealthier countries such as the UK and the US. Spirituality matters. Now, many people, won't come to a forgiveness workshop, or won't come, even at the workplace. I do offer this, and they're like, well, come in, because somebody's going to baptize us and sprinkle water. But spirituality matters. So what we found, and I found this in my study as well, regular religious attendance was strongly related with higher flourishing, even in secular society, highlighting the role of community and spiritual engagement. Now, religion as a social determinant of health is often ignored. But if you go to HHS definition, it has worship in there. And so they thought about that years ago. And I think what we do in this ministry is really to enhance that piece of religion as a social determinant of health. So this is some of the things from the first wave. Forgiveness is a global asset, right? We found that forgiveness significantly contributes to flourishing, as I mentioned the connection earlier at the onset of our conversation. And about 75% of these 200,000 participants reported they often or always forgive others, with higher rates observed among older adults, back to some of the findings in America, women, widows, and individuals who regularly attend religious services. So the more you hear about it, the more you can practice. And even in groups, we have a group on Friday nights where people come to talk about forgiveness. And with Emory University's help, we have found this to be true as well. So we are continuing to do that here. Childhood experiences shape adult flourishing. So if you're a person like me or others in America, about 60% of Americans have at least one adverse childhood experience. You find that these early life conditions like strong parental relationships, good health, and financial stability are linked to greater forgiveness and well-being in adulthood. And the reverse is true, based on even on the ACE study here. So that's a little bit about the global thing. And we could pull out the data around Nigeria versus Ethiopia and India, all of that's in the study that was just published today. So I'm still reading. But what is the reality in America? And the same thing, most of these same things are true. Many people hesitate to ask or grant forgiveness when they don't have anything to gain in return. Many Americans do not find it easy to forgive, but the physical benefits of forgiveness seem to increase with age. So the older you get, it seems to be closer to the tomb. People are more forgiving. It is also tied, as I said, in the Human Flourishing Study, to spiritual and religious practices and one's belief system. Many Americans believe we should forgive those who trespass against us. And participation in support groups or religious groups actually generate emotional capital and build spiritual capital, which shows a strong positive relationship with forgiveness, right? Running quickly. Data. This is some of the older data we have here on this in America. This is a University of Michigan study, 2001. 60% of Americans in this study reported forgiving themselves for past mistakes. 75% of people said they felt God had forgiven them. But only 52% of participants said they had been able to forgive other people. And 62% of Americans in this 2010 study said they needed more forgiveness in their lives. And so this is where we come in. We offer a weekly program, we have a monthly program, we have all sorts of programs to help people to forgive. But you might say, that's all well and good. What is, tell me more about forgiveness. I'm going to run through these slides quickly. Forgiveness is not avoiding somebody. It's not letting the offender off the hook, seeking ill will or revenge, holding on to hurt feelings. If you're doing that, you're not forgiven. Or even having a relationship with the person who hurt you. Or wishing somebody bad would happen to him. I wish he'd run off the road. Or, no, that's not forgiveness. Forgiveness offers an opportunity for transformation, whether it's loving again, healing, compassion, redemption, and change. All of this is on. Here's some quick benefits: less fatigue, insomnia, higher life satisfaction, less depression, fewer physical health symptoms. Lucia, as a nurse, very important.
Yeah. Yes.
Reduction in negative affect, increased self-esteem, and something very important. When a person who is in a hospice has forgiven themselves and others and feel like they've been forgiven for God, they even have a reduced fear of death in hospice.
That's true. I've seen that.
Some other things, there's greater spiritual and psychological well-being, less anxiety, hostility, lower blood pressure. We'll talk more about that. Lower risk for alcohol and substance abuse, improve hopefulness and self-confidence, improve relationships and reduce conflicts in marriage and family. And forgiveness even reduces the likelihood of vengeful responses such as crimes. So unforgiveness is playing even into the guns violence we have in this country, our broken marriages, all of that. And so by forgiving, we acknowledge offense was unfair and will continue to be unfair. But we know we have a moral right to experience anger. We know people don't have a right to hurt us. And we understand we have a right to respect. But we give up something we have a right to, which is our anger and our resentment, for something even better, that you can offer forgiveness. So I wanted to share this because every single session, somebody always asks, well, if I forgive him, do I have to go back to be married to him? And this is, it's self-explanatory, but forgiveness is unilateral. So I'll just quickly say a few of these. You extend it even if it's never earned. So I have forgiven people who are dead. You don't have to physically be in a relationship with somebody you have forgiven. But on the other hand, you can't get to reconciliation without forgiveness, and it is bilateral. It should be reciprocal, and you only give or get reconciled with somebody who has restored relationship based on trust, and you're offering this to the offender because he's earned it, right? Yeah. And it should be conditional based on repentance. So this is always a question I get from people. So I wanted to quickly run through this. But that's all the wonderful things about some of the wonderful things about forgiveness. But a lot of Americans need more forgiveness in their life, or they choose not to forgive. So I wanted to spend a few minutes talking about what happens when you're stuck there. Okay. So we might say, how can I forgive? It hurts so much. I was raped. I was bullied in school. People have kicked me out of my job. The list goes on of ways that you may be mad about something. But here's the definition of unforgiveness. It's this complex combination of negative emotions, such as resentment, bitterness, hostility, hatred, etc., that occurs when an individual perceives a transgression. Now, this is a 2002 definition. I want to point out that it could just be a perception. It might not even actually be actual. And people have gotten themselves into this. So about some things around forgiveness, linked to back pain. This was my first article that I read. When forgiveness is at work, or unforgiveness and all the anger, the bitterness, the hostility, the whole stress management system, because of the cortisols it's like constant flow of cortisol in the body. The whole body the system is dysregulated. It leads to weathering. So if you think of an African, I'm just going to say an African American and a minority who's already weathered by the implicit and systematic racism in this country. This now, when you add on forgiveness to it, it's like you're actually pushing yourself into an earlier grave. There's increased belly fat and other fatty deposits in the body because of the cortisol and the stress. Now, I know you know this, and your listeners know this, but the typical African American have about a 15 to 20% higher level of cortisol circulating than other populations.
That's very
you already have a higher cortisol level. When you add on forgiveness, you're basically pushing yourself to an early grave. I'm going to say that's maybe why many of us don't live to see our great-grandchildren or grandchildren. Poor sleep. Of course, sleep is a very often overlooked asset or concept for health, wholeness and well-being. You're not sleeping, Forget it. So you're tossing and turning. You have insomnia. There's anxiety and depression, and there's of course increased mortality in the sick. The unforgiving patient is more likely to go. In fact, the lonely, unforgiving patient is more likely to go even in hospice than somebody who is the opposite. Cardiovascular disease. This is maybe the system most affected by unforgiveness. We have tons of study to show that. Increased respiration, restriction to the heart, the flow to the heart, increased heart rate, increased blood pressure, the negative affectivity, the anger, the contempt, etc., have an adverse effect on coronary circulation. Some of the mechanisms, Lucy, and you're a nurse, you know all of this, is that it actually causes autonomic dysfunction, inflammation, and impaired vascular function. And we have a conference coming up in September. We'll have a cardiologist speaking about his work in the coronary artery, actually track forgiveness and emotions, all documented.
Fascinating. Yes, I love that.
So this is a massive attack on the cardiovascular system. And I could explain why many people have hypertension and other cardiovascular problems. Drug use in this country. We live in a land of polypharmacy. Unforgiveness, increased medication use, frequent trips to the hospital, alcohol abuse, substance abuse, and ill health. We call these people frequent flyers. Unfortunately, it's a bad name, but that's something that's often said. They're just trying to heal and to get help, but we don't often stop to figure out what's eating them and where they're coming in. So all of this, we give them another prescription, we send them out of the office, but that's not the key. Infections, even in older people in nursing home, research continues to show that people who are unable to forgive themselves or others or feel unforgiven like God have more infections. So could this, and I always ask these questions when I speak about diabetes, could this be helping to increase wounds and other things in nursing populations that are diabetic people who are not forgiven themselves and God or feel unforgiven? This increased infections also occur when older participants did not feel they had religious support, back to religion, from their congregations. This is all documented studies. I have references. The workplace is also a very big place. Most Americans are working. That's where most of us get our health insurance from. It's a perfect breeding ground for unforgiveness. Yet, it can wreck your career to be unforgiving. For instance, if you're mad with your boss, they hurt you. Unlike going home, Lucia, and saying to your husband, you have to sleep on the sofa tonight because I'm mad with you. You can't say that to your boss. And so you have to find ways to cope with unforgiveness in the workplace. So unforgiveness can actually negatively impact productivity. You should have said forgiveness, morale, attrition, mental and physical health problem. But forgiveness is an effective means of coping following being emotional hurt on the job. And that can promote good health, well-being, and productivity. We actually have a program we offer in workplaces to help with this, because you'd be surprised how much unforgiveness occurs in the workplace. And we spend more time there than when we spend sleeping. So it's important that if we can fix that, it's going to roll into other parts of our lives. Cortisol, we talked about that. This are some ways to reduce this naturally. I know we have meds, but I think for me, and I hope this is not going to be a problem in July 1, but I think we go to meds like everything else before we talk about how to naturally reduce this. Prioritizing sleep, regular exercise, mindfulness practices, deep breathing, even laughter. Try to find a way to laugh each day. You'd be surprised what it does. It's medicine. The Bible actually said that. Eating a balanced diet. All of these things are important for people with diabetes and chronic diseases. Limiting caffeine and alcohol. These can elevate your cortisol level, especially when consuming excess or late at night. Stronger relationships, social connectedness, support, getting a hug makes a difference. It actually lowers cortisol level. Adaptogens, lemon balm and other herbs can also help. But I say to people, consult a provider before starting them. And something at the very bottom of this is what we offer: forgiveness. Now, it's not a panacea for everything, but it does help. And as you forgive, you'll find those cortisol levels come down. You feel better, and all of the things we talked about will start happening. So I could stop here, but I wanted to just quickly share a few things that we do at the ministry, if that's okay with you.
Sure, that's fine.
So we talked a little bit about my background of the ministry. Here's our goals, mission statement, and vision. We work to heal our relationship for good. We realize that if you are in an unforgiving situation and you don't get to the root cause, which is where you're digging up and transparently talking about why you felt hurt, you'll be just covering the issue with a rug, and it will explode eventually. So we hope to heal our relationship for good. Our vision is to have people living free of unforgiveness and all its consequences. And our mission statement, which is on the back of my Zoom background here, is helping people grow and thrive with a forgiving heart. That's what we want to do. We have several program goals, and we continue to advocate for and encourage healthcare providers to assess forgiveness levels of all clients and refer them to caring providers or to ministries that work in this space. Because instead of over-medicinalizing people, we should get them the help they need. I have found that it's not what people are eating, it's what's eating them. And if we can fix this, we can fix their blood sugars and all that. We want to help individuals to forgive so they can live free of the shackles of unforgiveness. We implement trauma-informed care, and we work to build the awareness and the evidence base for addressing religion as a social determinant of health. And then we serve as a bridge between faith, community, and public health to improve population health. Here are a few things that we do. There's more. But we have adult sessions. We have a program for kids on Saturday morning. We have an annual conference. This year, I think we have about 4 MDs. We have people from academia. We have pastors at this conference. We celebrate the World Day of Peace, which is September 21st. We have support groups. We have an RT and culture. It was usually an RT and diversity program, which we do in the workplace, at conferences, chambers of commerce, anywhere people are congregating to work. We have a monthly podcast magazine program called Forgiveness Live. We do boot camps. We have an RT and forgiveness facilitators training, and we do one-on-one and group forgiveness coaching. And then we have the diabetes and chronic disease management services that we offer. This is as quickly as Friday nights for the AT for adults. And we work with Emory University, as I said earlier, to actually evaluate this with some very significant findings. And we love to share that with you. As you can see here, 90% of the participants in the study reported improvement in at least one of these forms of forgiveness, whether it's forgiving themselves, friends, etc. And of course, the program we develop is based on the social and emotional learning, which helps people to actually get to these 5 areas: self-management, self-awareness, making responsible decisions, building their relational skill, and being socially aware, which all of our clients need to have. So that was the Emory project. We have developed a guide, which our toolkit is an implementation guide where people can pick this up and implement this program in any workplace, any office, in any academic setting. We just signed a contract to work at the University of Chicago with this. So we're offering this, in any places that have people who have bought it for their family. It's about 300 pages long. All you need to do is purchase it, and it has everything, all the case studies, the poems, everything you need to. And it's really using stories to heal. So you're healing vicariously through somebody else's story. We have a kids program on Saturday morning. We have the RT and culture, which was formerly named RT and diversity, but we rebranded. Here's our RT and diversity findings. This was actually of the program I ran at the CDC, which is a quarterly program. Excellent results. People felt like this was psychologically safe. They could talk about any topic, etc. So this is a little bit about some of the findings here. They loved the work. They wanted to do more. So instead of quarterly, they wanted to meet more often, etc. We have boot camps. So we go to workplaces. We do it on Zoom. We can actually come into people's workplaces. We have fundraisers like our Pay and Shop and Sip. We have virtual support group. We have Forgiveness Live. So the theme this year is faith, family, forgiveness, and fortitude. And so that's going to be virtually starting on the 13th to the 20th of September. So in between that time, we'll celebrate International Forgiveness Day and the World Day of Peace. We have forgiveness coaching. So we offer one-on-one or group coaching, and we have packages, include forgiveness assessment. We have 3 months, 6 months, 1 year packages, and then forgiveness contracts. So that's all a part of what we do as we're coaching people. Our unique healthcare intervention is threading forgiveness assessment into everything we do. So whether it's your diabetes session, coming to manage your obesity or hypertension, medical nutrition therapy, you can't escape getting a forgiveness assessment, because I have found that if I get that part fixed, blood pressures are dropping, blood sugars are getting better, even people's weight is changing. And so that's important. We have a prayer call, and all of this, including the coaching that we do, is based on the REACH model of forgiveness, which is outlined here. These are the 5 steps, but there's lots of other things between there. And just to say, this model was developed by Everett Worthington in 2001. He is, I call him the America's father for forgiveness. He's maybe 70 years of research at the Virginia Commonwealth University, still researching around the world. But what Evie found when he did this thing was it was being implemented across the country. And then somebody killed his mom. And in his tears and crying out to God, he was reminded that he had this model for forgiveness and told, why don't you use it? And so he did. And this is what he used to forgive that person, so he could breathe and move on with his life. And it's a long story about that, but I'm sure if you want to, I can share you more information. So we use this in all of our groups, or the patient population. This is sort of the impetus. And the Flourishing project that I just reported also uses this around the world as well. And Evie is a part of that work as well. So I have run through that with like a bullet train, but I hope it gave you some idea of some of the reasons why we do this work, and how this connects to some of, especially metabolic syndrome and the cardiovascular system, which sometimes you wonder whether hypertension's come before diabetes or the other way around, which is a chicken or the egg. But all of this is tied to carrying that, all of that stressor, the cortisol levels that never comes down, and it just damages the body. And so I am done. If somebody wants to reach me, that's my contact information, and I am just excited to be here. Do you have questions for me?
Thank you so much, Dr. Meg. You can stop the share. Yeah, I really, really appreciate this amazing wealth of information that you shared with us today. And I'm going to encourage you, if you're watching, to go back and feel free to pause this video so that you can really read all the slides and kind of let it sink in, because I think that this is an area that is so important for all of us to understand, because it does impact every aspect of health. And there is such a wealth of research these days, and yet I think it's still not something that's talked about enough. And that's that link between our ability to forgive and the health that we experience. And I really believe that it is God's plan for us to learn the skill of forgiveness, to become like Christ and forgive as he forgives us. And when we experience God's forgiveness, I think it is such an important piece of being able to forgive others. If this was a topic that resonated with you, I would encourage you to check out Dr. Saunders' assessment and a consultation. The link is going to be right below this video, wherever you're watching this. And you also can take that assessment that they use in all of their activities to kind of see where you are in that journey to full forgiveness. And you have her contact information. So if you want to follow up, get more resources, you have the opportunity to do that. And just remember that health is wealth, and it comes by choice, not by chance. Thank you so much for being with us here today.
Thank you, Lucia. Thanks for having me, and have a good day. Thank you.